You're out camping in the wilderness, you're on a river, maybe you're on a rock cliff, and your friend, your wife, your husband, somebody encounters a pretty medium grade injury. Whether it's a broken hand, a broken ankle, it's a laceration, whatever it is, what are you going to do? Are you prepared for that? I'm going to show you how. Stay tuned. All right, so we have decided that since we're going on a pretty extended trip in the near future, and we've decided to put together a pretty decent first aid kit. And this is something that everybody should consider. When you're out there camping, you need first aid material. You know, how extensive you want it to be all depends on the environment that you're going to, how long you're going to be gone, how isolated you might feel that you're going to be, what are your resources for immediate care. And so with my military background, I decided to just get some basic elements of first aid. And I will explain to you, what we have and how I'm packing it. I want it all to go in this toolbox. We got this nice toolbox. It's got an upper shelf, and it's going to enable us to really get our first aid wares organized. And it's really important. It's really important because you don't know what you're going to encounter out there. You don't know what you might be forced to do to save a person's limb or life. So you have to be prepared. And so let's start off by showing you some of the stuff I have already packed away in little sub containers like this one. This is all of our bug stuff, So I have everything in here from sunscreen to off to bug spray, bug repellents, all that stuff. I think that falls under the category of first aid, right? I do. I think it does. And so that's in a tub all itself, right there. Then I have another container, another small container, and this one is, and I just mark it with a Sharpie. This one is like medications, creams, wipes, eye drops, etc. Right? So this one I have betadine, iodine. We have like a pure Vaseline. I've got this clear nail polish, which is really good if you're in an area that maybe you get like chiggers. I mean, like in the United States, they have chiggers. I'm sure they have something like that here. I get a toothbrush for cleaning out an infected area. Like I said, betadine. We've got this cleansing solution. These little multi-containers of iodine. And so the clear nail polish, if something gets embedded in your skin, right, instead of surgically digging it out, if you give it a coating of clear nail polish, it'll kill it. It'll be gone. And eventually it'll come out of the surface. And then I've got an assortment of like allergy pills and things like that. So right now, what I'm going to do, I'm going to put in some acetaminophen, this 800 milligram acetaminophen. I'm going to put that in here, and they fit in there nicely. I've also got some high dosage pain pills, pain reliever, like some kick-ass stuff. If somebody breaks a finger and I want to splint it, I can give them some pain relievers for it that are like the next level, right? So we got the 800 milligram. I'm going to take this small, I'm going to put the smaller one in there. And then I've got some light 500 milligram pain reliever. Melatonin we don't need. This is good. That's good. Yeah, so that's all I'm going to put in there right now. We've got some cyclobenzaprine. This is really good for if you have like a pulled muscle or something like that from hiking. That's really good to have in there. And that's about it. Eye solution is the last thing I need to put into this little box right here. I have Saran wrap. Saran wrap is really good if you get a wound, right? And you get a wound, or let's say it's just infected enough, so you can wrap it. You can treat it medically, put the ointments on it, and wrap it with some Saran wrap in order to keep it clean until you get to proper Medicare. We've got wipes, medicated wipes. We've got Green Cross hand sanitizer soap. We've got some regular tissue. We've got some 70% solution alcohol in that, and we have it in a spray bottle. And we've got some just generic soap, hand soap. And then we've got this, it's like a massage cream with a moisturizer. Then we have a box of rubber gloves. Not gonna take the whole box, probably just throw like, maybe a dozen in a little bag. And then we've got these really nice, they're like a detoxing. If you got like a fungal infection on your foot from hiking, you put these on and it'll clean them. And then we've got just a nice healthy box of Band-Aids. Then we've got Q-tips. Q-tips obviously for air cleaning, but also if you have something around the eye you want to clean, something in the nose that needs cleaning, or if you want to irrigate and treat a wound, these are really good. And then we've got a bunch of mothballs, a bunch of cotton balls for that. And then, and that's it for now. So the couple things we need to get, and of course, what I recommend to everybody is a True Blue combat tourniquet. You need this. You need one of these whenever you go out into the woods. You need a real deal combat tourniquet. And these probably run USD, this is probably about $30, but I'll tell you what, it'll save your life. It's worth every penny. So number one element in your first aid kit should be a combat tourniquet. And number two should be a combat dress bandage. So then I have an extra pair of glasses for me. Then I've got nice surgical scissors. I've got some toenail or fingernail clippers. And then I bought these little retractable razors that, if need be, can be used as a scalpel. See it come out right there. These things are beautiful. I've used them before and they are beautiful. And if you ever need to just like get in someplace, to get something out, these things work wonderful as a scalpel. And that's it. So my goal today is to get all this stuff and put it in this box. That's the hard part. That's the hard part. But I do have some duplicates that I can get out of here. All right, in the top of our toolbox, our kit, we've got these nice little mini drawers. Got a nice size one here. We got this, and you can use these. You can use anything you want, but like this right here, this long drawer right here. What I'm thinking about is and I have Ziploc bags to keep things clean, right? So as I add critical things like a scalpel into my kit, I want to make sure that the scalpels stay clean. So I'm going to put my scalpels into a Ziploc bag, little mini freezer bag, seal it up, get the air out of it. I'm going to roll it up nice and tight, and it fits right in there. See that? Perfect. Nail cutter, that can go in all by itself, just right here, right? Just right there. My scissors, I think my scissors might fit in here. They do. The scissors fit in there just right. I'm going to bring you over here. We'll bring this like that. There you go. See how my scissors fit in here? Just perfect, right? Close that. Now, I'm gonna put this to rest for a minute. My glasses fit in here? No, they don't fit in here. I could put something in here. I have a torch in case we need to sterilize something with fire. We can do it with that. So there's a bottle in here. I can put the spare bottle right in here. Perfect fit. Yep. Okay, so that can go in the garbage. Okay, so let's look inside, okay? So open it up. It's funny because when I bought this, my wife was like, babe, that is like too big. But you're gonna see here in a minute, it's not too big. It is not too big at all. So I'm gonna start with these containers because they make a good subfloor for everything else. And you can see how, look at that, perfect fit. That is a perfect fit in there, right? That's gonna go on either side. Put one there, and then I get the other one I'm gonna put right over here. Look at that, right? You kind of think I know what I'm doing. So the gloves, this is a huge box. We don't need this many gloves. I'm actually, one would be prepared, and at the same time, one would hope we never have to open this box. We never have to even open this box on any trip. That's the number one thing, right? So we've got our wipes. The wipes can stack nicely right on top of there. Let's see, our green soap, sanitized soap, that'll fit right. See, here's the thing we gotta watch out for. We still have this drawer, right? So these are too high, right? So we gotta keep that in mind. So we've got some nice napkins, tissue, sanitary. Then we've got our Band-Aids. We've got our detox care. Let's see, we've got our soap that can go in here like this. I think you're kind of seeing this a little bit. Let me move this in here like this, okay? Then we've got some spots in here. I can put my just like that. My wet wipes. Q-tips can go in here like this. It's looking nice. Problem is going to be these bottles. That's going to be a problem. And then we got our cotton balls. We can put the cotton balls right in here. Let's check our drawer. Drawer, nice. It's a good fit. It's a good fit. I got room up here for all my bottles. So I'm going to put my saran wrap, my wound wrap here. Then I'm going to just like fill this stuff in right here. This, I think, let's see. I don't know, which you think would be better? The spray or the bottle? I think the bottle might be easier to pack, I'm not sure, but I see spots in here. So I'm gonna take my combat tourniquet. I'm gonna have that right in here somewhere. Somewhere like this. Then I got my wound dressing can go right there. Then we got this. This or this. I need to put space in here. I need my glasses to go in here, just like that. So let me see, let me think. Do I have any space in here? If I turn this upright, does the drawer fit in there? Yes, it still fits. And I can put, that's too high. But what I can do is, can I stand these up vertically? Look at that. Then I can take my alcohol. I can lay my alcohol. I'll take the bottle. I'm not going to take the spritzer. I'll take the full bottle, right? My alcohol, and then cotton swabs and cotton balls rather. I just got to puncture them a little bit. Right? Let's see. Fingers crossed. It does. It fits. It fits. The only thing, we got our Q-tips here. Maybe here. I'll put my, like that. So then, let's see how it looks. It's good. It's good. It's very good. All right, so we've achieved our goal and we fit everything in to our first aid kit. This is not going to go in there. Everything fits in there. Everything's organized, ready to go. We know exactly where everything is. It's good. So the only thing I have to put in here now, I need to get some saline solution. And the saline solution, if I buy some small bottles, they'll go right in this right in this jug right here, this box, the saline solution. We need saline solution in case there is any type of eye incident, we can deal with it. But saline solution is like super, super important. Back near there, back near there. It's looking good. So saline solution, and then I'll fit my gloves in there. I could probably take the gloves, just take a few of them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11, 12, right? So the gloves, where can I put my gloves? Can I roll them up small, right? Can I roll them up small and fit them in these little compartments? I don't know if that'd be good or not. You know, but they do fit, they do fit, you know. I can fit 2 at a time in each compartment. So there's 3, 4. I'm just stuffing them in there. I can go back later and neaten them up, right? I could probably go do something like a sock roll, you know, just like get them and roll them on here, roll them, right? And then just take this, you know, just like you do your socks, and just stuff them in there. And like on this side, I would do it just like this. So I think that's what I'll do. I'll get these, I'll make them neater later on, and that way I have 6 pair of gloves ready to go, surgical gloves all ready to go. That's taken care of. Now the only thing we need is our saline solution. I'm debating whether to get a suture kit or not. I don't know if we would really have a need for it. What you need to do is, like I said, you need to evaluate where you're going to be. You know, are you going to be in a place where you can at least contain a wound and go seek professional medical attention within an hour? If that's the case, you're good. If you're out in the wilderness, I mean, there is like nothing around you, then yes, I would recommend some numbing spray and a suture kit. That would be really important. Our purpose for our first aid kit is to stabilize the wound, stabilize the injury, and then either if it's a low-grade injury, seek medical attention when we get back home. If it is a dire emergency, then we will stabilize the wound and go seek medical attention immediately. So that's it. That's our first aid kit, and I hope you got something out of this. You know, you can design it any way you want. You can put into your first aid kit anything you want. but this is a good basic kit. When you get into iodines and these scalpels and things like that, it's getting a little more advanced. So it's beyond just Band-Aids and tape. So that being said, build yourself a first aid kit and make it what you want it to be. But it's important, no matter what, make sure you have something out there with you. All right? I'll talk to you guys later. Bye.